you're most likely to be a target for a mosquito if you eat bananas.
I did not know that, Tanya.
You guessed it, summer's in full swing. Well, I wouldn't have guessed that.
No.
But there's something in bananas, evidently, that mosquitoes like. Now, to keep them away from us, lotion sprays and candles, and it's easy to get confused with all that, but schedule activities to avoid the times when mosquitoes are most active. Dress in light, loose-fitting clothing. Apply insect repellent repeatedly. Place a large fan on the deck to hinder mosquito mobility. Mosquitoes have weak wings and they're weak flyers.
Wow.
So you can just sweep them away,
Did
blow
not
them away.
know
We
that.
can do that.
Light patio and decks using yellow bug lights, and make sure doors and windows have tight-fitting screens. So there you have it, and cut down on that banana
On the
eating.
bananas, and I'm thinking probably then, Tanya, if that being the case, then chimpanzees probably get a lot of mosquitoes.
I was thinking of the same thing.
Are always they do. They have them crawling around on them all the time.
And they're eating bananas
Maybe that's
all
what
day.
they're always picking on each other.
Correct.
Could pick out the mosquitoes.
You know
the
how they
mosquito
do
bites,
that?
maybe. The nits.
Dr. Leisa Grgula with us, chiropractic physician, talking about strengthening our core. And then a little later, we're meeting her in the kitchen. She's juicing for us today also.
Yeah, it's fun.
Chiropractic care, there can be a blend of both modalities, can there not?
Yes. Some chiropractors just adjust, and that's good, and that is one school of thought. And then, like myself, I also have adjunctive therapies. Sometimes the muscle stim, we incorporate massage and different activities like exercises, and that is actually part of the treatment. A lot of times a patient will think that's just an adjunctive. It's something that's separate and it's above and beyond. It's the icing on the cake. No, it's part of the whole meal, so to speak. It's the entire treatment. So that's how I practice, and I like to incorporate it. We find that the adjustments last longer. The patient is more comfortable sometimes before getting an adjustment, and it just works well. That's
So
how
you
it's
kind of
treated.
use a holistic approach?
Yeah, whole body, exactly.
Okay.
And I like to look at the whole body, not just the spine, and that was how I was taught up in National College of Chiropractic up in Illinois.
Do you evaluate someone when they walk in the room?
Yes, and it's hard for me to even look at someone, even in a park or in a setting, and going to Disney World. I have to watch how they walk and watch their gait. I look at their that's just the way
So
it is.
do you watch how we sit? Like Tanya and I are sitting here right now. Do you
Yes.
evaluate us as we're sitting here?
I can do that. Well, a lot of times it is the posture. I know we have to. And what you'll do is you drop a plumb line through a person, and you can see that in the posters that we see I have in the office in the anatomy. They drop a plumb line. You don't always notice that, but that plumb line should go through the ear and the shoulder, and then it goes the hip, behind the knee, down to the ankle, and that's how. So if you look in the mirror or you walk by a picture with glass, just kind of check yourself every once in a while. Make sure that ear is
But
back.
yeah, it's interesting you say that, and it's interesting we were talking about bananas, because in my chiropractor's office there is a big poster that shows a banana. You know how a banana is, and it says some things break when straightened, or some things have a curve.
They're supposed to. Our spine has a curve.
and
That's
it
right.
was
That's a
talking
good-
about the spine. So I don't know where I'm going with that.
Well, I think
You pick up on it.
But I think it's very, very important. We should start at childhood, shouldn't we? Because
Yes.
so many people slouch.
Yes.
And
we're
like you're saying,
born.
the posture. Your posture is important.
But we
the
don't
way
want to be bored straight.
You don't want to be bored. Exactly. And as a matter of fact, I have a patient right now who's 17, and he does motocross. And so he just had a horrific accident, and think they're always having accidents with those things. But and his spine is becoming very straight because of the numerous whiplashes. So we have to work on restoring the curves. When we're born with two primary curves, which are the curves going this way, like the hump of our back and down on our sacrum. As we learn to crawl, we get our secondary curves, which is our neck and at the low back. So we're supposed to have the curves coming in, the curves coming out. And you're exactly right. Some things are not supposed to be perfectly
What about
straight.
the position of the head, though? Because I know many people get a hump. I know people who have a humpback.
Different
because they're-
reasons for that, mainly postural. Sometimes they are hereditary. However, when we're in pain over time, and they start to scrape their nose on the floor, so to speak, and they get the hump. So we work on that with chiropractic and massage to make sure you maintain the mobility of the spine up
So
there.
we can straighten that out.
You can work on it, and we can't always promise that someone's going to be textbook normal, after treatment, but we want to catch this when we're young. Don't wait till you have one, and then we have to fix it.
Because is it really that we're more pliable when we're young?
We're more pliable, we're more receptive to the treatments in any forms of treatments.
Right, exactly.
And it's just easier to change anything. Any problem in life is easier to fix when it's this big than when it's this big.
How important is that bone structure? And I'm talking about internally now. Say with abdominal problems or problems throughout other parts of our body? Is that structure critical to
It's
the
very
well-being?
critical. I always say that the spine is basically our fuse box or our breaker box. That's where all the nerves are coming from. So it's coming off your central nervous system, your central cord. So if that spine is not in alignment, bottom line is it's going to be pressing on those nerves, a lot more sophisticated than that, but to really explain, and those nerves are going to organs. So how is that stomach going to work properly if something is constantly pressing on the nerves that go to the stomach? That's how chiropractic can work as well. Again, we don't want to wait for the acid reflux to begin to treat for it. Let's stay in alignment, and then these things won't happen.
So that helps the hiatal hernia.
Hiatal hernia. We actually do moves
situation.
for that, where we'll go in and do a deep massage down
Dr.
by
Hancock does that very same thing.
Yeah,
Yes.
and it can instantly relieve a patient. Instantly relieve. I have patients who walk in and I'll say, I don't care where you are, get in, give us a call, let us know, and I'll do it within
Should they
minutes.
go
they're
back
relieved.
for repeat
Oh,
performances?
yeah. Oh yeah, we
Okay.
do that. Even though they are not flared up, we'll generally work on them in between flare-ups so that they don't get them. I've got some people when they go on vacation or they'll go out to Vegas, they come back, so we know before they leave, we'll make sure we do it, and when they get right back to prevent.
Yeah.
Because sometimes it's what you eat, not if you eat quickly or fast or late at night, which we have heard, but sometimes it's a food that'll make that flare up.
It can, but again, why is that food doing that to you and not that food doing it to
okay.
you? There are allergic reactions, some genetics that you just can't tolerate certain foods. There's blood type, and there is a lot of truth to the blood type and what we should be eating and should not be eating. And then, of course, the alignment.
So that's why you do a blood workup, don't you?
I do, I
tells you
can
a
do
lot.
them, yes, absolutely. And first of all, I really like to know people's blood type. And so many of the real high-ended medical grade supplement companies, I've talked to different PhDs in different companies, and the first thing they'll ask me is, what's the patient's blood type? And that's when the light bulb went on for me, because I realized, well, this guy doesn't know this guy. Why are they? Because they know. And no, we don't use it as a hard rule that you only eat this food, and we don't use it that way. But I know personally I use it as a guide, and it works really well for a lot of people.
Dr. Leisa Grgula with us, chiropractic physician. She will be with us when we come back. True Hollywood Story at the end of our show?
Yes.
11
At
a.m.?
11 a.m. That's exactly right, Tanya. I almost forgot. But yeah, True Hollywood Stories at the end of our show, and today featuring
Sean Diddy Combs. All of that right here on AM Arizona.